Gentlemen, I said, you look great already. What do you need? What do you think he said? what do you think he wanted to improve? What we discussed is that I'm going to give him, of course, a subtle treatment. Do you have a sharpener? But let's focus on male aesthetics. The most important area for males is definitely the mandible, okay? And actually, it's not just the mandible, it's the masseter. It's masseter augmentation. And as per your request, I'm going to show you male cheek augmentation. So for males, a little bit of shadow is good. He doesn't have to look very young. You know, if you ask any woman what kind of man she's attracted to, it's not the very youthful man. You know, actually, a lot of men become more attractive when they get older, right? They need a few wrinkles. They need to have an interesting face, not a perfect, shiny, wrinkleless face. No, they need to have an interesting, intense face. They should have some wrinkles. Maybe not too many and not the negative wrinkles, but definitely the crow's feet. Okay. Could you clench your teeth? Like to bite? Bite? Yes? Okay. I feel the masseter muscle over here. There's the belly of the muscle. Okay, relax. Relax. I will draw it on the other side as well. Okay, because I think the camera is better positioned from this side. Can you clench again your jaw? Yes. So I feel here the masseter muscle. Here's the belly of the muscle. And this is also something that is nice in men. If he's chewing a gum, you see the muscle moving. This is looking powerful. This is giving the man a powerful look. Can I have anesthesia, please? So I'm drawing the mandibular line. This is the mandibular angle over here. And the mandible is going like this. I will give you a little... Can I give you an injection? Yeah? Does he know what's going to happen? Okay. That's good, you know, to have a patient that knows what's going to happen. Okay. So you see here, this is the bone. And then there, that's where the masseter is attaching to the bone. Okay, so I'm going to find my entry point. 1, 2, 3, click. Injection. And I move all the way down towards the periosteum. And sometimes it may feel like I'm injecting in his teeth. And as you can see, I'm giving a lot of numbing because he's a man. Can I have the pre-hole, please? And can you give me a syringe of Radia's Plus, please? On a cannula. Short one. One, two, three. You don't feel that anymore, do you? Okay, good. Okay? Yeah. Yeah? Good. So, he's a virgin. He's a virgin. He's never had any fillers before. Thank you. Okay. So, what I'm going to do is I'm going to go with my cannula through the adhesions of the masseter muscle. Oh, actually, could you change this cannula for a short one? Because the long one is a little bit flexible, and this is such strong adhesions that you have a higher risk of bending the cannula. I've bent a lot of cannulas trying to get through these adhesions of the masseter attaching to the mandible. Thank you. So first I have to get through the skin. If I find, yes, I found my entry point. Now I have to get through the adhesions of the masseter. So I'm through now. 22 is going to be fantastic here as well. That's even more rigid. So now I'm moving the cannula below the muscle, over the periosteum. I feel the periosteum. Are you okay?
Yeah.
Okay. So now the cannula is in between the bone and the muscle, and I'm just advancing it to the belly of the muscle, and I'm starting to inject. Oh, sorry. The bone, the periosteum can be a bit sensitive. But then there's anesthesia in the radius plus. And the nice thing about injecting him in the submuscular level is that when he's chewing his gum, we are not obscuring or hiding the muscular movements. So we're just pushing the muscle away from the bone. And actually, when I was checking this technique in a cadaver dissection, there's actually part of the product ending up in the muscle. Okay, let's have a look. Can you sit up? I mean, that looks quite powerful, don't you think? Bruce Willis, huh? Yes, yes. Bruce Willis. Excuse me, can I have your autograph? So, you know the danger zones in this area, right? You know that there's the facial artery running here. So, is that enough correction for you for this little depression over here? Is that good? It's good, huh? Okay. Nice and sharp projection. Okay, great. So I'm going to do the other side, and then I'm going to go back to the lady. All right. So can I give you another injection here? So mandibular angle, 1, 2, 3. Sorry. So I'm giving you a lot of numbing. And I have to admit, you know, I know that this is painful because I've had the same treatment. So I know that as a man, we are actually a baby when it comes to treatments like this. But you are being very, very good. Yeah. Needle? Radius plus, please, on the cannula. Yeah, so the parotid gland should be more or less somewhere around here. So this is a danger zone. You have to be conscious of the danger zone of injecting radius. If you inject radius intraglandular, you might block parotid ducts. That could obstruct saliva flow, that could result in stones and parotitis. So can I have radius plus, please? I think this one. Can I have this one? Is it in a short syringe? Perfect. Okay, So again, I want to go through the adhesions. First of all, I want to make sure that I'm subcutaneous, yes. So through the adhesions of the ligaments, of the adhesions of the masseter muscle, and click, I'm getting through, yes, now I'm through. So as you can see, I had to use quite a lot of force. Sorry, this line is distracting me. I want to create another line. Can you clench your teeth again? Bite? Yes, bite. Okay, this is the belly, and this is the border of the muscle. Okay, and relax. So I'm underneath the muscle, in between the muscle and the mandible. And as you can see, I give small boluses. So small bolus of about 0.1 each bolus. And I want to see that masseter muscle coming up. Can I have another syringe of Radius Plus with a long cannula, please? Sometimes what patients tell me is that they have the feeling like the radius, the injections are actually in their teeth. So it feels like injecting like on the jaw, it's like feeling it like it's in the teeth. And of course the alternative would be to take a sharp needle and with a sharp needle just go through the muscle straight to the bone. Okay, that would be a very easy alternative. So then you take your needle, you go through the muscle until you feel the periosteum, and then you start injecting multiple boluses. But the big difference between that technique and the cannula technique is that if you do that technique on a cadaver, you can see it, that with the needle technique, all the product is ending up inside the muscle to accentuate the shape of the bone. So I move the cannula subcutaneously. So this is above the SMUS. So skin, subcutaneous fat, SMUS, parotid gland, muscle, and bone. So here we make sure we are above the parotid gland because we are above the SMUS. And on this one, we made sure we're not in the parotid gland because we were below the muscle on the bone. Okay? Thick retrograde linear thread. Oh, that's not too thick, a little bit more. Okay, 0.2. And then 1 over here. So I stop just before the gel, and I give another nice retrograde linear thread, about 0.2, maybe 0.3. Is it working? It's working. You see the definition. Okay, entry needle. Sorry, just gonna mark again. Alar tragal line. Supraline. Lateral limbus line, so more or less over here. Should have the point of maximum projection. Thank you. So from the top of the mandible, make an entry point, and another one over here. Thank you. Radius plus, please. As you can see with the man, I'm using more Radius plus because I want to have that full viscosity. I want to create sharpness. I go through the SMAS, click, advance the cannula over the periosteum until I reach that point over there. I'm a bit too low again. Now I'm good. Always check the tip location because the flexible cannulas, sometimes they start bending and they end up in other places where you didn't intend them to be. Okay, retrograde linear thread, just one single line. Just create a little bit of sharpness over here. Second entry point. Again, this is not typical male attractiveness, but this is rejuvenation. Just to reduce the volume loss of the deep medial fat compartment, the cheek. Okay. Not too much, because, as I said, men don't necessarily need to look too young, you know? They need to look interesting. And then what we did on the other side as well, reduce that little depression over here, subcutaneously. Just one product, guys, just one product. See what you can do with just one product. As long as we use our heads, you know, be safe, use our anatomical knowledge, use safe injection techniques, you can have amazing results with one product. It's very nice to know that it's safe, you know, you don't get any granulomas or any other problems like that. We have a long-term result. The product is economic because you don't need too much product to achieve a good result. If you want to do this with hyaluronic acid, you would need much more, many more milliliters. A little bit in here. Can I have the pre-hole again? Contraindications. Well, of course, the regular contraindications like active skin disease, infections, etc., malignancies, stuff like that, of course, like the normal ones. Actually, there used to be in the instructions for use, they used to say immune disease, but they took it out. So you can, I don't know why they had it in there, but apparently they had it in there in the past, but it's taken out. There's just the contraindications, you know, being pregnant, you know, lactation. No contraindication. You're worried about the calcium? Actually, I think we give our patients calcium if they have osteoporosis, so I don't see a problem with giving them a little bit in the dermis or in the soft tissue. Sorry? So if the patient has osteoporosis, then you know, it's not a contraindication for Radia's. It's not. I mean, if you look at that amazing book, you won't find osteoporosis.